Good afternoon, everyone. Thank you for joining the National Caucus and Center on Black Aging, Incorporated, NCBA, as we present a webinar on what older Black adults should know about pneumonia and lung cancer. Joining us today are Michelle Call and Michaela Pittman. Michelle Call serves as the Senior Director of National Infectious Disease and Immunization Initiatives at the American Lung Association. Call has a 16-year tenure with the Lung Association, where she began her career educating youth on the dangers of tobacco use throughout Connecticut. Her past experiences include working on advocacy issues in the area of tobacco, lung health, and healthcare, conference planning and implementation for healthcare professionals, and the development, implementation, and evaluation of health education programs. Call or Michelle is currently responsible for the strategic planning, development, and tactical execution of project-related national programs in the area of infectious disease and immunization. She serves as the content expert and informs the organization on updates and trends in infectious disease. Michelle also is responsible for cultivating and expanding collaborative relationships with patient, public, and private organizations and agencies. Her work focuses on influenza, COVID-19, respiratory syncytial virus, pneumococcal pneumonia, pertussis, among other infectious respiratory diseases. And also, Michaela Pittman is a member of the American Lung Association's National Lung Cancer Education and Patient Engagement Team and serves as the manager of nationwide health programs. Michaela is the Lung Association's lung cancer screening content expert and plays an integral role in developing, managing, advising, and implementing key lung cancer screening and tobacco cessation integration efforts across the nation. She leads with a particular focus on health equity, systems change, and resource sharing within organizations and communities. Michaela comes from a background in infectious diseases, having led disease surveillance and community support efforts in Milwaukee and Chicago. She holds a master's degree in gender, society, and representation from the University College London. Thank you both, Michelle and Michaela. And Michelle, I will turn it over to you. Thank you for joining.
Thank you so much. Hello, everyone. It is really nice to be here. Thanks for joining us and thanks for the invitation. I'll start at the very top, the American Lung Association's mission and commitment to lung health. The American Lung Association has a long history of saving lives by improving lung health and preventing lung disease. We were founded in 1904 by a group of volunteers dedicated to ending the major lung health threat at the time, which was tuberculosis. With TB largely controlled in the United States, we have extended that mission to other respiratory diseases. And thanks to our donors, volunteers, program and event participants, staff, etc., we are the trusted source for lung health education, lung disease research, program services, and advocacy. Next slide, please. The Lung Association serves all individuals in the United States through 4 strategic imperatives: defeating lung cancer, championing clean air for all, creating a tobacco-free future, improving the quality of life for those with lung disease and their families. And we accomplish that through our education, advocacy, and research. It is important to recognize our discussion cannot move forward without touching on the historical injustice in Black communities that has shaped where we are in public health and healthcare as it relates to our 2 topics today. So next slide, please. And then next. To start, it's important that we understand health equity and some of the terms you may hear throughout this presentation. Disparities are preventable differences between individuals or population groups, while inequities are differences that are unnecessary and avoidable, unfair, and unjust. Despite decades of efforts to reduce and eliminate health disparities, they persist. And in some cases, we see that they are widening. Simply put, health equity is the opportunity for everyone to reach their full health potential, regardless of any socially determined circumstance. In a time when structural and social inequities facing Black Americans are being brought to the forefront, it can no longer be ignored that lung health is a racial justice issue. Next slide. Health disparities include differences in health outcomes, like how healthy you are, how long you live, and what health conditions you have. Health care disparities are the differences between groups of people when looking at health insurance coverage, access to and use of care, and the quality of health care. Disparities occur across races, ethnicities, income, age, where you live, disability status, among others. These disparities are influenced by the factors that are on the screen. We continue to see racial and ethnic disparities in health due to a long-standing history of racist policies and events and a continual failing, basically, of our systems and structures. Next slide, please. Additionally, historical traumas, like the syphilis study at Tuskegee, provides critical context for interpreting present-day mistrust. However, to rebuild trust, everyday racism must be confronted in the present. And we can acknowledge the current efforts being done today. Last year, the family of Henrietta Lacks and the biotech company Thermo Fisher reached an undisclosed settlement. This case is not only historic, but groundbreaking in consent, justice, and research. Next slide, please. There we go. Through big tobacco marketing, some Americans are protected from secondhand smoke while others are not. Corporate marketers use flavors to entice specific groups to try tobacco products like youth. Access to treatment for tobacco-related health issues varies widely by population, geography, and other variables. And discrimination increases stress, driving higher rates of tobacco use for some groups. Researchers found that stores in predominantly Black neighborhoods were up to 10 times more likely to display tobacco ads, particularly for menthol brands, than retailers in areas with fewer Black residents. Next slide, please. Here are two maps highlighting redlining, a policy that has concentrated people of color into communities and neighborhoods where resources have been taken away. In the map on the left, the red represents a hazardous environment, while in the right map, the red highlights the large percentage of the people of color who live in the neighborhood. They are directly correlated. Next slide. Here in the same map, you can see that as the population of Black residents increase, the price of menthol cigarettes decreases. Tobacco companies flooded these neighborhoods with special price promotions, advertisements, and Black publications, and have even financially supported historically Black colleges and universities and other community-based events. These marketing tactics have led to a huge health disparity concerning tobacco use among Black communities, but it is not the only kind of targeted advertising to take place. Next slide, please. When we think about equity and vaccination, we think about removing barriers to vaccination. Many barriers were addressed during the COVID-19 pandemic, though they were not sustained. We were able to successfully close the disparities gap between white and Black communities with the COVID-19 primary vaccine series, and also increase the life expectancy of the Black community in the second year of the rollout. There were vaccination sites in communities that don't have access to regular health care. There were extraordinary efforts made to foster relationships between public health, healthcare, and the communities they serve. You could get free Uber, Lyft rides, and public transportation. You were able to ask important, pressing, or clarifying questions to people you trusted in the community so you could make an informed decision about your health care. Many of our disparities in vaccination rates, as shown on the screen too, are due to access and factors that I've previously mentioned. However, we also saw the rise of misinformation, disinformation, and the politicization of vaccines. Misinformation really is just getting the facts wrong. People who share misinformation don't do it with the intent to deceive. Disinformation, however, is malicious. It's deliberately spreading false information. We've had the anti-vax movement as long as we've had vaccines. What is new, though, is how information is shared and the coordination and targeting from the movement. There really are only 12 people who spearheaded the spreading of most anti-vaccine messaging. They're mostly white and mostly affluent people, and they have special interests tied to it. They make a lot of money off of fear and conspiracy. The Children's Health Defense, a prominent anti-vax group, actually targeted and still targets Black communities under the veil of a new civil rights movement, tying vaccination with previous instances of medical injustices to feed fear and exploit them. They promote vaccine lies in order to eat away at confidence in vaccines and the institutions that monitor them for safety and make them available. There are also a lot of people on the internet looking to cause division, harm, and disease, and we call rage bait for a reason. And that is what gets shared the most and the fastest. The good news is that there are many community organizations, national organizations, public health departments, healthcare institutions, etc., that are working really hard to build and rebuild trust in the public health system by listening to and acting on what is important to community members and providing accurate, science-based information and promoting policies to reduce health disparities. Next slide. Now let's talk about the meat and bones of our discussion today, pneumonia and lung cancer. November is a great time to talk about both of these diseases. It's Lung Cancer Awareness Month. It was World Pneumonia Day on November 12th. And while going through treatment for lung cancer, it's common to have lower levels of white blood cells, which are our body's main defense against infection. When I talk about immunocompromise or a weakened immune system, that is what I mean in relation to lung cancer. So, has anybody had pneumonia before? And what do you think causes pneumonia? You can put that in the chat. Next slide, please. So, pneumonia is an infection of the lungs that causes the lining of the air sacs to become inflamed and the air sacs themselves to fill with pus or fluid. It can be caused by bacteria, viruses, and less frequently fungi. Though individuals who are immunocompromised are more likely to get fungal diseases. The types of pneumonia include community acquired, meaning you got the pneumonia while you were out and about in your community. And I'll spend the majority of the time speaking to this type of pneumonia. Some common bacterial pneumonias that you get out in the community include pneumococcal or mycoplasma. You may have heard of mycoplasma as walking pneumonia, which is a little bit less severe. Viral infections that commonly cause pneumonia include COVID-19, flu, RSV, and then if we're talking about fungal causes of pneumonia, we're typically talking about valley fever, histoplasmosis, or blastomycosis, all of which are found in different parts of the United States in soil. Healthcare acquired pneumonia is just what it sounds like. It's developed when you get pneumonia in a healthcare setting, like a hospital, or shortly after a stay in a healthcare setting. This type of pneumonia is usually more severe because the germs causing it tend to be more aggressive, such as a staph infection, and they can also be resistant to antibiotic treatment. This type of pneumonia typically occurs after 2 or more days of hospitalization, And then we have ventilator-associated pneumonia. I hope nobody on the call ever has to deal with this, but that occurs after someone has had the assistance of a ventilator, which is the machine that helps you breathe. Many factors affect how serious a case of pneumonia is, such as the type of germ causing the lung infection, the person's age, their overall health, and generally older adults and adults with underlying medical conditions like lung disease are at increased risk for pneumonia. Individuals with a weakened immune system, like somebody undergoing cancer treatment, are at the greatest risk for pneumonia. Fall and winter time, where we are now, sees more spread of germs that cause respiratory illness in the community, but you can get pneumonia any time of the year. Next slide. Symptoms can vary from mild to severe, and you'll see that when Michaela covers lung cancer symptoms, many of these overlap. It's important to note that individuals with lung cancer often see the overlapping symptoms long term and they worsen over time versus when you have pneumonia. The symptoms in bold on the screen are symptoms that are often seen in pneumonia, but not in lung cancer. If you get a fever while going through chemotherapy, this is an emergency and you should call your doctor right away. It may also be the only sign that you have an infection. Pneumonia is a leading cause of hospitalization in adults, and while most cases can be treated successfully, it can take weeks to fully recover, and sometimes longer in individuals with weakened immune systems. And then individuals with late stage lung cancer can really have a challenging time recovering. Next slide.
Recovery from a serious lung infection may take longer than you expect. It can take weeks or even months before you are feeling back to normal. How long you feel sick depends on several factors, including the severity of your infection, your age, and your overall health status. It's important not to get discouraged, but gradually take steps each day to help your body recover. An upper respiratory infection may affect your sinuses and throat. A lower respiratory infection may affect your airways, but primarily impacts your lungs. Lower respiratory infections tend to be more serious and require longer recovery. Pneumonia is the most common respiratory infection, but there are many others. One thing all lower respiratory infections have in common is inflammation. Fluid buildup and cell debris in the airways can take time to clear. The symptoms you are feeling, such as cough, fatigue, and shortness of breath, may linger as you heal. Signs and symptoms to watch for and report back to your healthcare provider include if your fever returns, you experience chest pain or worsening shortness of breath, or if you develop any new symptoms that concern you. While you are waiting for your body to recover, focus on taking the medications your healthcare provider has prescribed and good health practices, such as lots of rest so your body can recover, fluids to keep the mucus in your lungs thin, and good food so your body has energy to heal. It is important to keep your vaccinations up to date and any chronic health conditions well managed to help prevent future respiratory infections. Given enough time and care, you will hopefully be feeling like yourself again soon. Learn more at lung.org.
The good news is that you can reduce your risk of getting pneumonia by following public health recommendations and the advice of your healthcare team. Next slide. Vaccines can help prevent infection by some of the bacteria and viruses that can cause pneumonia. Immunizations could prevent many deaths from pneumonia each year. It is important to stay up to date on your recommended vaccines. It's also important to talk to your oncology team if you're going through treatment about timing of vaccination and whether you may need to be revaccinated. People who have weakened immune systems have lower defenses against infections, and their bodies may have a harder time building lasting protection from a past immunization or infection. If you look at the slide, the last three vaccines on this list are childhood vaccines. In addition to being vaccinated yourself, if you're going through cancer treatment, individuals who you are around frequently should also be up to date on their vaccinations. This decreases the likelihood of spread to whoever has cancer, if it's you or if it's a loved one. So when their defenses are low. Next slide. Pneumococcal disease is any infection caused by the Streptococcus pneumoniae bacteria. Pneumococcal vaccination protects, actually helps protect against pneumococcal pneumonia, which protects against 3 different diseases: pneumococcal pneumonia, bacteremia, which is a bloodstream infection, and meningitis, which is the infection of the lining of the brain and spinal cord. In adults, pneumococcal vaccines are recommended for individuals 19 to 49 with certain underlying medical conditions and risk factors. That includes individuals with weakened immune systems, chronic lung disease, and cigarette smoking, among other risk conditions. And then all adults 50 or older are recommended a pneumococcal vaccination. Next slide, please. For flu vaccination, everyone 6 months and older is recommended to receive a flu shot each year. There is preference for 3 vaccines for adults 65 and older, but if those 3 vaccines are not available, you can also receive a standard dose flu vaccine. Pneumonia is a complication that can occur after getting the flu, so it's another good reason to get your annual flu shot. Next slide. Adults 60 to 74 who are at increased risk for severe RSV illness should receive an RSV vaccine. This includes individuals with chronic lung disease and moderate or severe immunocompromise, and also all adults 75 or older are recommended to receive an RSV vaccine. And this is a 1 lifetime dose recommendation, so you don't have to be revaccinated. Next slide. COVID-19 resulted in many more hospitalizations and deaths in individuals with immunocompromise and cancer prior to COVID-19 vaccine availability. Everyone 6 months and older is recommended to receive an updated 2024-2025 COVID-19 vaccine. Adults 65 and older and persons with moderate to severe immunocompromise should get additional doses. And for individuals who are immunocompromised, a healthcare provider may also recommend a preventive monoclonal antibody. And this delivers direct antibodies prior to any infection to provide an extra layer of protection against COVID-19. Next slide. You may be wondering about insurance coverage, and private health plans, Medicaid, and Medicare are all required to cover all of those vaccines without cost sharing. There are a couple caveats, as there always are, right? So with private health plans, you would need to use an in-network provider, and there are some exceptions for grandfathered plans prior to the Affordable Care Act, and then short-term plans. But in general, most insurance plans cover vaccinations with no cost sharing. And then you can get vaccinated in several different places, at a doctor's office, at a pharmacy, at a community clinic. If you're looking to get several vaccines at the same time, your best bet is probably at a pharmacy. Next slide. There are additional actions you can take to help prevent severe disease, like maintaining good health habits, washing your hands with soap and water, covering coughs and sneezes, eating well, staying active and getting adequate rest, staying hydrated. You can choose to wear a mask. The better fitting masks are more effective, as are N95 or KN95 masks. But if you choose to wear a mask, wear the one that you can wear comfortably for the time you are wearing it. Quitting tobacco use is always recommended to improve your overall lung health. Review and update any personal health action plans with your healthcare team regularly. This could include an asthma action plan, COPD action plan, or something similar. And then if you have a chronic medical condition or have lung cancer and get sick, talk to your physician sooner rather than later, as they might be able to recommend a treatment plan for you. And that could include antiviral medications for flu and COVID-19. And then you can order 4 free at-home COVID tests now to have on hand at covidtest.gov. These are nice to have this time of year during the holidays and while everybody's getting sick. Next slide, please. Treatments are important. Prevention is important, and then treatments are very important to decrease symptom severity and complications from pneumonia. Treatment is recommended as soon as possible for anyone eligible. So antiviral medications are an important tool for management of COVID-19 and flu for individuals at increased risk of complications and hospitalization. I have convalescent plasma on here, which is used far less frequently, but this is really for people who have severe immunocompromise, and a healthcare provider may recommend it. Really what it is transfusing the liquid part of the blood from someone who has recovered from COVID-19 and has lots of antibodies to the person with immunocompromise. And so that allows that person's immune system to recognize and attack the infection. And then there are antibiotics, which are used to treat bacterial pneumonia only. Antibiotics do not treat infections caused by a virus. Complications can certainly occur if pneumonia is left untreated, so it's very important to be treated as soon as possible, especially if you have lung cancer. Next slide, please. An early warning sign of lung cancer that is often missed is frequent respiratory infections, including pneumonia. People with lung cancer face respiratory infections either before treatment or during treatment for a few reasons. Tumors within the lungs can block the airways, causing infection. Treatment can lead to weakening of the immune system, which makes it easier for an infection to happen. And sometimes there are structural changes in the lungs due to surgery or treatments causing inflammation. Pneumonia diagnosis for an individual with lung cancer can be scary. So there are many complications that can occur as a result, and it can be life-threatening. And this is why I'm stressing prevention and treatment. Next slide. There are some similarities between pneumonia and lung cancer, which can lead anyone to believe early on that it is pneumonia. When you are able to recognize the differences between the diseases, your personal risks, and your own body, you can better communicate and help your healthcare team understand your specific health concerns. And honestly, for anything, this is a good rule of thumb. If you are getting frequent respiratory infections and seeing different healthcare providers each time, it is important to communicate that. Maybe you went to a walk-in or urgent care one time, or you headed over to the ER because it was the only thing that was open. And then another time you went to your primary care physician, and your doctor might only have that one visit on record. So you have to communicate. And then also make sure that you're communicating your symptoms, any worsening symptoms, anything you find concerning, because you know your body the best. It's important to understand lung cancer so that we can catch it early before it spreads and learn to advocate for ourselves when something just doesn't feel right. I'll now turn it over to Michaela to discuss lung cancer.
Amazing. Thank you so much, Michelle. So, what is lung cancer? Lung cancer is a cancer that starts in the lungs, and a cancer that starts somewhere else but moves to the lungs is not considered lung cancer. Within lung cancer, there are very few symptoms in the early stages, and most people don't develop noticeable symptoms until the cancer is spread, when it is harder to treat and the prognosis is worse. Because of this, many people aren't diagnosed until later stages. There are two main types of lung cancer: small cell and non-small cell, as well as various subtypes within those two types. Non-small cell lung cancer is more common, and this type of cancer usually grows and spreads to other parts of the body more slowly than small cell lung cancer does. Some doctors say that no two lung cancers are the same, and not every person receives the same treatment, but I will go more into depth in a few minutes there. Most people don't know that lung cancer is the #1 cause of cancer death among both men and women, killing more people than breast, colon, and prostate cancers combined. The average 5-year survival for lung cancer is among the lowest of all cancers, and close to 235,000 people will be diagnosed with lung cancer this year alone, with the rate of new cases varying state to state. Despite lung cancer being the #1 cause of cancer deaths, awareness about it is still very, very low. And that is one reason why activities like this one are so important, so we can all feel empowered to really bring lung cancer out of the shadows so more people know the risk factors, their symptoms, early detection, and treatment opportunities. On the screen, you'll find the many different lung cancer risk factors. Similar to pneumonia, smoking is the #1 cause of lung cancer, contributing to 80 to 90% of all lung cancer cases. And radon is the second leading cause of lung cancer. However, there are other risk factors that may also lead to a lung cancer diagnosis, and these include exposure to hazardous chemicals like asbestos, arsenic, and petroleum products. There's also particle pollution, genetic factors, and even secondhand smoke that might be a factor towards a lung cancer diagnosis. There are many different symptoms related to lung cancer. And as I mentioned, symptoms usually do not appear until cancer cells have spread to other parts of the body and prevent other organs from functioning properly. At this point, because there are very few nerve endings in the lungs, a tumor could grow without causing pain or discomfort or without you even knowing. So when these symptoms are present, they are different in each person, but they might include hoarseness, frequent lung infections like pneumonia, coughing up blood, weight loss, headaches, bone pain or fractures, and blood clots. And many of these symptoms are initially vague and can appear as a persistent cough, shortness of breath, loss of appetite, or chest pain, which, as Michelle mentioned, can really be confused for other issues like allergies or asthma or even pneumonia. Many doctors don't consider lung cancer in people who don't smoke as well, and that population often goes misdiagnosed for quite some time. We encourage you to be persistent with your doctor if you feel like something just isn't right, or if you're concerned about any of the risk factors or symptoms that I've mentioned or Michelle has mentioned. So I discussed lung cancer risk factors and symptoms, but knowing that symptoms tend to appear once the cancer is already spread, how can you catch lung cancer before it spreads and ultimately improve your treatment outcome? So the main benefit of lung cancer screening is preventing death from lung cancer. Lung cancer screening finds over half of lung cancer cases at an early stage when it is more curable compared to only about 25% without screening. So who is eligible for lung cancer screening? The current guidelines for lung cancer screening include meeting these 4 criteria. So you need to be between the ages of 50 and 80 years old. You need to be asymptomatic or not showing any of the symptoms that I or Michelle discussed. Have a 20-pack year history of smoking. So this means 1 pack a day for 20 years, 2 packs a day for 10 years, etc. And you need to currently smoke or have quit smoking within the last 15 years. There is currently limited evidence to suggest that those who do not smoke need to be screened for lung cancer, but that is also why it is so important to know the different lung cancer risk factors and symptoms so that you can be proactive and get screened early. And guidelines are always changing. So it is also important to note that. You can learn if you are eligible for a lung cancer screening by either taking our Saved by the Scan quiz at lung.org/savedbythescan, or by calling a lung health navigator at 1-800-LUNG-USA. If you meet the lung cancer screening eligibility requirements, a follow-up with your doctor for a shared decision-making appointment comes next. This is where you would address the risks and benefits of a lung cancer screening, what the costs would be, and where to get coverage, helping you find a facility to get screened, what screening results mean, and what to do after a lung cancer screening. This is a really great time to discuss any of your concerns with your care team, including your symptoms, personal history with other infections like pneumonia, bronchitis, etc. Once you come to a consensus, your doctor will order that screening. And the 1-800-LUNG-USA line can help and support with all of these questions as well, if you just need a little bit of guidance or support as you go through this process. One of the biggest questions that we get is, how much does a lung cancer screening cost? Well, for most people, it costs nothing. Medicaid expansion and most private health insurance plans cover or will soon cover screenings at no cost to patients if they meet this criteria. But of course, the Lung Association stays engaged with any changes to insurance plans or availability, and our website will always have the most up-to-date information should there be any changes in coverage. But what should you expect with a lung cancer screening? So the scan itself is painless and quick and takes less than a minute. You will lie down on the table of the machine and it will slide in and out of the scanner while you lie as still as possible. You might be asked to hold your breath, and the technologist who runs the scan will walk you through the entire process and take snapshots of the inside of your chest. Depending on those results, you might not need any further action outside of an annual screening as recommended. And in some cases, doctors may ask for you to come in for a follow-up scan to keep an eye on things to see if anything changes, any changes occur in the results that were received. In other cases, your doctor may order further tests to get additional information, such as a PET scan or an MRI. There are a couple of ways of diagnosing lung cancer. So this includes imaging tests, and this is where an X-ray image of your lungs may reveal an abnormal mass or a nodule, and a CT scan can reveal small lesions in your lungs that might not be detected on an X-ray. There's also sputum cytology. So if you have a cough and are producing sputum or phlegm, looking at the sputum under the microscope can sometimes reveal the presence of lung cancer cells. A sample of abnormal cells may also be removed in a procedure called a biopsy. All of this information helps determine the type, the subtype, and the stage of the lung cancer. Once doctors have a tissue sample and place it under a microscope, they may see the type of lung cancer a patient has. Non-small cell lung cancer makes up, as I mentioned, roughly 80% of cases, while small cell lung cancer makes up roughly 10 to 15% of all cases. Small cell lung cancer is almost always associated with cigarette smoking and is usually treated by chemotherapy. The types of cancers are named based on how the cells look when viewed under a microscope. Non-small cell lung cancer usually grows and spreads to other parts of the body more slowly than small cell lung cancer does, and it often has more treatment options. Once the type is determined, the care team determines the stage of the lung cancer. The lung cancer staging is when doctors find out where the lung cancer cells are located, the size of the lung cancer tumor, and if and where lung cancer has spread. Lung cancer staging helps determine what treatment options may be best for you. Staging gives some information about lung cancer prognosis, but does not predict how long an individual will live. But non-small cell lung cancer stages range from Roman numerals 0 to 4. And in earlier stages, surgery is available as a treatment option. If the tumor spreads, surgery becomes less effective and is no longer recommended. These small cell lung cancer is a bit different as it is staged as either limited or extensive. And these stages really help us understand why it's so important to get screened and detect lung cancer early to help improve the chances of survival for those at risk. After diagnosis is confirmed, treating lung cancer becomes the next step of managing disease progression. Most of you are probably familiar with chemotherapy and radiation as the primary cancer treatments, but there's also surgery, which involves removing part of the lung. There's targeted therapy drugs that address the exact mechanisms that is causing the cancer to grow, while immunotherapy drugs harness a person's immune system to fight the lung cancer. Some treatment options can weaken the immune systems or structural changes, which could lead to life-threatening conditions like pneumonia or other lung infections. And many cancer patients may need to be revaccinated against diseases they received vaccines for as a child. However, vaccine recommendations may also vary due to treatment and side effects that you're experiencing. So definitely talk to your doctor. Palliative or supportive care can help a person cope with side effects from treatment. In fact, it is recommended that patients receive it from the start of their journey, regardless of prognosis. This is not the same as hospice care. So if you know someone who's going through cancer, ask if they've connected with a palliative care specialist, especially if they're struggling with symptoms or side effects related to treatment. Many people don't even know to ask for this kind of care, and it can really help improve a person's quality of life. There are further tests to help doctors get more detailed information about the makeup of the tumor that they cannot see under a microscope. It involves testing tumor tissue for abnormalities in its DNA and levels of specific proteins in the tumor. These tests are sometimes called biomarker, molecular, or genomic testing, and doctors would use tissue samples for further testing by sending them off to a lab. Results typically take about 2 weeks to come back, but are often very much worth the wait. Because if doctors know exactly what causes the tumor to grow, a patient may be able to receive additional treatment options like targeted therapies and immunotherapy, which are those treatments specific to each mutation. There is definitely a need to increase biomarker testing rates in communities most impacted by lung cancer disparities. This test is not always brought up in conversations with doctors, so it's definitely important to prepare the right questions and stay informed, to really ask your doctor from the beginning and to stay involved throughout your treatment plan. In the past decade, lung cancer research has made significant advancements, leading to a nearly 50% increase in the 5-year survival rate. However, this progress has not been shared equally, and communities of color, particularly Black Americans who are woefully underrepresented in these studies, have been disproportionately affected. There are over 10,000 lung cancer clinical trials available and run by qualified researchers across the country. And these highly monitored studies can look at many things, like how to prevent the disease, new ways to detect or diagnose a disease, and even ways to treat a disease. And it's important to note that you can withdraw from a clinical trial at any time if you feel it is not serving the purpose it should.
In scripture, it all started in March of 2020. You can imagine the shock of my family when we all learned that I had this stage 4 lung disease. My decision to participate in a clinical trial came as a result of my conversation with the oncologist. When they did the PET scan and identified the targeted area where my stage 4 lung disease is located, part of the challenge is in the African American community, we don't have a lot of data because many African Americans don't participate in clinical trials. So at that time, we had a conversation and they had some research studies underway, and he asked if I would be interested in participating in it, and I said yes. One of the things that I would love to share with the African American community, me being an African American woman, is how we respond, if you will, to health care. I know a lot of it has to do with trust, and believe me, I get that. But when you think about your health care, you read that in scripture, your body is your temple. It really is just that. So taking care of it and making sure that we find the right providers that can help us is very critical. One thing we have to remember is we are all dealt in a deck of cards, so to speak. The moment we come into this earth, we have cards, and within our deck, sometimes we're just dealt a bad hand, and we just have to decide how we're going to play the hand we've been dealt.
So released just this morning to coincide with Lung Cancer Awareness Month, the 7th edition of the State of Lung Cancer showed how the toll of lung cancer continues to vary by state, examining the rate of new lung cancer cases, survival, early diagnosis, surgical treatment, lack of treatment, and screening among those at high risk for lung cancer. The State of Lung Cancer report found low screening rates and that states must do more to protect their residents from lung cancer. And new this year is state level insurance coverage of comprehensive biomarker testing. This report empowers the public with information that can leverage to start the local change we need to see, which in turn can lead to data supported policy change and support both the lung associations comprehensive approach to lung cancer and advances strategic imperatives to defeat lung cancer. So you can visit lung.org/SOLC to learn more about lung cancer in your particular state and take action to join us in the fight to defeat lung cancer. The report also shows and includes data on racial and ethnic disparities for the above measures where available, showing that people of color who are diagnosed with lung cancer face worse outcomes than white individuals. In fact, Black Americans with lung cancer were 15% less likely to be diagnosed early, 19% less likely to receive surgical treatment, and 12% more likely to not receive treatment at all. And there are many reasons why we do see these outcomes. Over the years, we interviewed members of the Black community to learn more about how they handle challenges through a lung cancer diagnosis in various focus groups and in individual interviews. Oftentimes, we hear that individuals are underinsured and have a hard time covering the costs of care. They also mentioned that there may also be other barriers, such as lack of access to transportation, inability to get time off, lack of access to childcare and other family responsibilities, keeping them from going through with treatment. So there is hope, and we're going to go through some free resources and ways to really help you take control of your care and beat lung cancer if you are diagnosed or you or a loved one ever need it at any point. So we did share a lot today, so we'll kind of connect the dots with some key takeaways. So first, lung cancer symptoms can look similar to pneumonia and potentially lead to a misdiagnosis. Frequent lung infections can be an early sign of lung cancer. Vaccine recommendations may vary among individuals with cancer due to treatment or side effects. But for those with lung cancer, pneumonia can be particularly dangerous. So it's important to self-advocate as you know your body and risk factors and symptoms best. There is a lot you can do to prevent pneumonia and lung cancer. Make a plan to quit smoking or help others quit smoking. We are here to help through with our various quit programs, including the Lung Association's Gold Standard Freedom from Smoking program. You should know the risk factors for each disease, and that's why we're here. We're here to help. So we definitely recommend knowing those risk factors and those symptoms for those diseases and making a plan to decrease your exposure or learn more. Maintain or start healthy habits like regular exercise, adequate rest, and eating a healthy diet. Talking to your doctor and staying up to date on vaccines is definitely key, as we mentioned. And then, of course, share what you learned with others. These disparities and the awareness of a lot of these diseases don't make any movement unless we share what we know and what we've learned with others and those around us and our family members and communities. So definitely take what you've learned today and share it with those close to you. Here you'll find a series of online training courses that can really take you into an even deeper dive into the topics that we discussed today, including lung cancer, infectious respiratory diseases, and tobacco basics. And you can find these free courses at lung.training. And then whether you're a patient or care for a loved one with a lung disease, the American Lung Association is here for you throughout that process. Our patient and caregiver network is a free patient-centric community that really connects people living with lung diseases and their caregivers with peers in very similar situations across the country. Our website is incredibly expansive, and we would love to share all the resources that we have with you today on this particular call, but there's so many to share. So above, you'll see some links to some of these materials that we went over during this presentation, as well as some new ones that can really help guide you as you either talk to your doctor, make decisions, or need any additional support. And if you don't know where to start with all the information that we provided, our lung helpline is here for you. We can definitely support you. Our knowledgeable staff have a wide range of experience in the healthcare industry, and it's our mission to provide thorough answers to all of your lung health related questions and connect you to resources that you need, including COVID-19 guidance, quitting smoking, connecting with local resources, finding a doctor or a specialist, and even a healthcare center, just to name a few of what we can do. And then we also have our lung health navigators as a part of our lung helpline. Our navigators provide free one-on-one direct support for lung cancer, including screening, COPD, and asthma-related inquiries, walking you throughout the entirety of that journey and your treatment, and really supporting you each step of the way. So if you don't know where to start or what's next in your healthcare or treatment plan, give us a call and we can definitely support you there. But if anyone wants to reach out to us or anything after this call, I have their contact information here. And absolutely, Angela, I see your comment in the chat. We can go ahead and open it up with questions.
So thank you, Michaela and Michelle. I think it was a lot of information. It was a lot of great information. I enjoyed the videos as well as the graphics. So we do have some questions in the chat. And I'm going to kind of start from the bottom and go up because I probably have a question similar here. But one of the last comments was, my stepmother succumbed to lung cancer in 2023. Can I please ask you for some guidance on how I can get my family to understand the severity of speaking to their healthcare providers about screening?
Yeah, I mean, that is definitely something that we tackle on a daily basis. And I think part of that has to do with the stigma around lung cancer. Not many people know what it is, or the severity, as you mentioned. So we have quite a few different resources on our website, and I'm happy to share those after this call. But I think one of the biggest things that you can do when you are speaking with a healthcare provider about a screening is really identifying those eligibility requirements. I think that's the biggest thing. Not every healthcare provider will mention a screening. Not every healthcare provider will ask you about your tobacco use or smoking history, or even report that and include that in their data. So it's definitely important to be as open as you can about your history and your concerns. If you've had somebody in the family, especially with a history of lung cancer, that is definitely something to disclose with your healthcare provider. They might be able to support you there, but you would need to meet that eligibility requirement through the United States Preventative Services Task Force. So those requirements that I laid out, as those are the guidelines that are really recognized by most insurance companies at this time, but that's always changing. And your doctors might have other suggestions for you. You may need to pay out of pocket if you don't qualify based on those guidelines, but definitely happy to provide additional resources to talking to your healthcare provider about the severity of lung cancer. Absolutely.
Thank you, Michaela. And along with that, you did mention in the slides those guidelines to be eligible for lung cancer screening. And I probably just a question or comment. There are a lot of environmental factors also that you mentioned that can contribute. So one of the things we didn't see was environmental factors, like that exposure to radon wasn't listed there. But if someone knew that they were exposed to some of these environmental factors in their home environment or their community, is it any way that letting their provider know that would they be more eligible, or would that kind of that's a fine line about if you're eligible or not?
Exactly. Yeah.
Okay.
I mean, in terms of what is covered by most insurance plans, the guidelines are pretty strict for billing purposes. But those environmental factors, radon, I mean, it's the second, second largest risk factor for lung cancer. It's unfortunately it's just not included in those eligibility requirements at this time. But the eligibility requirements are always changing based on research. So the more research there is regarding those environmental factors, including radon and genetics, we can definitely expect to see, hopefully in the future, some changes to those guidelines to allow for more people, even more people, to get screened because of those different risk factors.
Okay.
Otherwise, yeah, it's pretty strict based on those guidelines that I shared.
Now the next question is, you mentioned about the lung cancer trials, and it was that one video. Where can we go to find more information about the lung cancer trials that are present now or current?
We have all of our trials listed, a lot of different trials listed on lung.org. I believe it's lung.org/clinical trials, and each of them have different eligibility requirements. So you may or may not qualify for each one. It might be based on treatment or your medication or the stage of your lung cancer. But I'm, again, happy to share all those resources for you.
And Ms. Telesford, I know is it promptly 1 o'clock now? Do I have time for one more question? Or if I see questions in the chat, would you like me to just copy those and we'll get back to the individuals?
I think we have time for a couple more questions. Yes.
Okay, so
Sure.
the next question then I'm gonna ask is here, let's see. How often should an older adult get a pneumococcal vaccination? Is that
So
a
that
one and done, or can you explain more?
it's not necessarily a one and done, no. It really
Okay.
depends on which vaccines you have received previously, your age. The adult vaccine schedule can be a bit complicated, but your healthcare provider can help you determine if you need a pneumococcal vaccine and when.
Okay. All right, thank you. And then let's see. Here's another one. Does the Lung Association support patient-centered or personalized care?
It sounds like one of our advocacy initiatives that I am not really well enough versed to speak to.
Okay.
We can get back to you on that.
Okay, thank you. Can you please, this says, can you please speak to secondhand smoke? And I don't know if that's secondhand smoke related to lung cancer or secondhand smoke related to pneumonia. But could you talk about that, please?
Well, secondhand smoke is a risk factor, especially if you're around it a lot, for both a pneumonia diagnosis and a lung cancer diagnosis. So, I mean, secondhand smoke, our bodies are not made to breathe in any kind of smoke. Our lungs are not meant for that. So as we breathe in cigarette smoke, any kind of smoke, it does damage our lungs. And so it makes you susceptible to lung cancer. It makes you susceptible for lung infections as well.
Okay, thank you.
Sure.
And one more question, maybe. You mentioned earlier, it says that pneumonia was community acquired. So are we able to catch pneumonia from someone else?
Yes, community acquired can be caught from others through respiratory droplets. So when somebody coughs, sneezes, or even talks, and then you breathe in the droplets, that's why we talk about covering your coughs and sneezes with your elbow or in a tissue. Don't use your hands, but use a tissue so that you're not expelling so many respiratory droplets that other people can then inhale.
Okay. All right. Well, now it's 3 minutes after 1, so I am not going to continue to hold you. I'm going to turn it back over to Ms. Telesford, but on behalf of the National Caucus and Center for Black Aging Incorporated, we really appreciate this webinar. It was great information. I learned a lot, so hopefully our participants learned a lot as well. So thank you, Michelle and Michaela. And Ms. Telesford, I'm going to turn it back over to you.
Thank you, Keisha. Thank you, Michelle. Thank you, Michaela, and everyone for joining us. We do appreciate you. And I do have a bronchitis question that I'll email you later. Thank everyone. This will end and stay tuned for our next webinar on Thursday. Thank you. Have a good evening, everyone. Bye-bye.